During which stage of cognitive development does children begin to have imaginary friends? So we know that this is a recall question of your knowledge on Piaget's stages of cognitive development. So if you are unfamiliar with this, you can go to Unit 1, which is the human behavior section, and brush up on these stages of development. So the question wants to know around which age do they begin to have imaginary friends, okay? So I'll take you through a brief synopsis of each one of these stages to kind of, let you know what they all are. So in the formal operations stage, I like to remember this. I have different ways of trying to remember all of these stages. So in the formal operations, this is adolescence through adulthood. And so we know that during this stage, we're able to use symbols and relate to abstract concepts such as algebra and science. And I like to remember this is because, we do become more formal in our thinking as we grow older. So that's how I remember that this is the stage for adolescence and adulthood. During this stage, we can also think about things in systematic ways and come up with theories and consider possibilities. We also can ponder about abstract concepts and relationships, such as being in love or social justice, any of that. So I think it becomes more formal. So because the question wants to know, when do we begin having imaginary friends? This is definitely not the stage where we begin to have imaginary friends. So we're going to X that one out. The pre-operational stage, I like to think of I like to break these down. Pre-operational is before we actually, become operational as, individuals. It's kind of how I think of it. So during this phase, this is usually toddlerhood through, let's just say early childhood. So that's anywhere from about maybe 18, 24 months to about age 7. Okay. So I would say that during this stage is when, between at the age of 18 months or 2 years old is when we do begin to have imaginary friends. However, let's go through the other stages just to be sure. Sensory motor, if we break that down, we know that during this stage we have the person that our individual is using their sensory and their motor skills to kind of navigate through their cognitive processes. So this to me already reeks out infancy, because we know that babies, they are only aware of what's right in front of them. And because they don't know how things are going to react, they're constantly experimenting. So this is why they're shaking things, throwing things, putting things in their mouth. They're basically learning about the world through trial and error, and they're using their sensory and their motor skills to do that. So this is infancy, and this normally lasts probably till about 2 years old. So when we have infants or whatever, they're not worried about imaginary friends. They're not even able to think abstractly like that yet. So I'm definitely going to rule out this one. So that leaves us with D, concrete operational stage. This is usually ages 7 to 11 years old. And the thinking here just becomes they become less focused on themselves. So whereas here you're a lot more egocentric, where everything is me, 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 me. Here in the concrete operational stage, you start to come out of that. You start, thinking about others. You're able to think a little bit more symbolically when it comes to not everything being about you. So definitely, you definitely don't want to, or you don't see a 7-year-old beginning to have imaginary friends, unless there's maybe some mental issues going on or whatever. However, that is not the stage where they begin to have imaginary friends. So this is usually referred to in the stages of cognitive development as magical thinking. So you may see it written that way on your exam. So just understand that B, the pre-operational stage, is normally when they start having this magical thinking, imaginary friends. Usually, toddlers, they're playing with themselves, talking to themselves. So that's how you can remember these stages of development. cognitive development. So your answer here is B. A social worker at a family clinic is referred a family who is seeking help with communication issues. The parents inform the social worker that they expect their children to follow strict rules or they are severely punished. The children states, "We don't understand some things, but we just do as we are told." Which parenting style are the parents most likely using? Okay, so we know we have a social worker at a family clinic. She is referred a family who is seeking help with communication issues. The parents inform the social worker that they expect their children to follow strict rules or they will be severely punished. Okay, and then the children states, "We don't understand some things, but we just do as we're told." Okay, so the question is asking us which parenting style are the parents most likely using. So we are looking for the parenting style in this scenario. So here we are. We know that the parent says that they expect their children to follow strict rules or they will be severely punished. And the children say, "We don't understand some things, but we just do as we're told." So this would require you to know the different types of parenting styles. And so I'll just go ahead and give you briefly what they are. But definitely, if you're not familiar with this, you would want to go back up and refresh on the different types of parenting styles. So A, authoritative parenting style. Okay, authoritative parents, they have rules and they use consequences, but they also take their children's opinion into account. They validate their children's feelings while also making it clear that adults are ultimately in charge. So that doesn't really sound like, they're expecting their children to follow strict rules, okay? So we know authoritative parents, they're pretty open and fair. Okay. So next we have permissive parents. Now, permissive parents, they're lenient and they only show up pretty much whenever there's a serious problem. They kind of just let their kids do whatever. So that's definitely not what we're, dealing with in this scenario. So we're going to cross that one out. Now we have authoritarian. A lot of people get authoritative and authoritarian confused. So definitely make sure that you know the difference. Make sure that you're reading the words correctly because these two can trip you up and they will be on the ASWB exam. Now, authoritarian parents, the children are expected to follow strict rules that they establish, and failure to follow these rules usually result in punishment. Authoritarian parents, they fail to explain the reasoning behind these rules. It's usually because I said so. So that's exactly what we're having right here in this scenario. So we know that this is what the answer is, okay? And so the last option, which is corporal, which I'm going to go ahead and put corporal punishment here. And we know that corporal punishment, it attempts to stop unwanted behaviors by causing the child to feel physical pain or discomfort. So it's mainly physical punishment or physical correction. So that is not what is listed here because it says they're severely punished, but they don't say how. So it doesn't mean physical or anything. So this is just a recall, and you would have to know the different types of parenting styles to get this answer correctly. A social worker is seeing a middle-aged woman who is struggling to find herself after being at the same job for 22 years, never being married, and her only child now being off to college. She reports feeling unhappy with life. This woman is most likely in which stage of psychosocial development? So this is a question that will recall or will require you to recall your knowledge of Erickson's psychosocial development stages. So if you are not aware of what goes on during each stage, I would suggest that you go and kind of brush up on that. So in answering this question, We are going to just break it down, just understand what we have going on. We've already read the scenario, so we know that we have a middle-aged woman, okay, who's struggling to find herself. And this is after she's been at the same job for 22 years. She's never been married, and her only child is now off to college. So she reports feeling unhappy with life, okay? Because this is what she reports. This is going to be, a presenting problem here. But we now need to find out what the question is asking of the social worker. So this woman is most likely in which stage of psychosocial development. So they're not asking anything of the social worker specifically here. They just want to know which stage of psychosocial development is this woman most likely in. She's a middle-aged woman. She's struggling to find herself, and she reports feeling unhappy with life. So which stage would that be most indicative of? So again, you would have to know these stages of development, the ages and stages, what goes on within each. So we will start with the process of elimination, one answer choice at a time. So answer choice A, generativity versus stagnation. Okay, so we know that during this stage, this happens during middle adulthood, where individuals, we establish careers, we settle down within relationships, we start our families, and we develop a sense of being part of the bigger picture. This normally happens between the ages of 40 and 65. So this is middle adulthood. This is when we're giving back to society by like raising our children, maybe mentoring, being productive at work, and becoming involved in community activities and organizations. By failing to achieve these objectives in this stage, we become stagnant and feel unproductive. So this could possibly be the stage that she's in, because this is a middle adulthood stage, the ages of 40 to 65. But of course, we want to also evaluate the other answer choices. So we're going to leave A on pause for now. So industry versus inferiority, we know that that's ages 6 to 11. And the primary question here is during this phase is pretty much, how can I be good? Because you have a 6-year-old, 6 to 11-year-old, they're just focusing on, how can I be good, stay out of trouble, or, all of that stuff. Oh, and I failed to mention that the question here during this phase is, how can I contribute to the world? Okay. So considering choice B, a 6 to 11-year-old, first of all, that is not a middle age. So we know that that's not going to be the answer. So we will eliminate that one. Answer choice C, initiative versus guilt. We know that this is also a younger stage. This is actually ages 3 to 5. And the question during this stage is, am I good or bad? Okay. So that is not relative to the presenting problem or to who we're dealing with in the situation. So definitely this woman is not in the initiative versus guilt stage. So we will eliminate that one. D, intimacy versus isolation. Okay, so knowing in this stage normally happens ages 19 to 40. And the primary question here is, will I be loved? Or will I be alone? So that leaves us with answer choices A and D. So we're looking for a lady that's middle age. So we need to determine which one of these are middle age. Will it be 40 to 65 or 19 to 40? And also, she's feeling unhappy with life. She's been at the same job for 22 years. So she's never been married. Her child is now off to college. So being that she's unhappy with life, I would say that, the best choice would be generativity. I'm sorry, I struggle with this word. I'm not ashamed of it. Versus stagnation, because she's feeling unhappy with life. She's feeling stagnant in life. I could understand why somebody would think, intimacy versus isolation, because she's never been married, and her only child is off to college. However, this isn't ages 19 to 40 is not really considered middle adulthood. So she is mainly concerned about, her contribution to the world at this point. So the answer is A, because this is the time frame that we do establish our careers, and it tells you that she's been at the same job for 22 years. This place is, this woman middle adulthood. If we would consider this as being middle adulthood, I mean, really, a 19-year-old can't be at a job for 22 years. So that's why I would eliminate this one. So you have to be able to know these stages, and know the ages accordingly to these stages. And so 40 to 65 is the middle adulthood age, and that's why answer A, I'm not going to try to pronounce it again, is the correct answer. A social worker is referred a client who has a history of substance use. He informs the social worker that he is done and stopped using cocaine 3 days ago. He appears anxious, trembling, and reports having difficulty concentrating and nightmares. In order to best meet his immediate treatment needs, the social worker should. Okay, so we've read the entire scenario, which is the first step. Now we need to determine what phase of the process we're in. So it says that the social worker was referred a client. So this most likely insinuates that we are somewhere in the beginning processes around, engagement and or assessing the client. So it tells us that he informs the social worker that he is done. We always want to pay attention to what's in quotations that comes from the clients, because it is going to be directly related to what the presenting problem is. So he says that he is done and that he stopped using cocaine 3 days ago. So he appears anxious, trembling, reports having difficulties concentrating, and having nightmares. So this is his symptoms. So we want to determine what the presenting problem is. And of course, the presenting problem here is the client that is presenting with these issues, because this is what's happening in the here and now. Yes, he informs the social worker that he is done. This is part of the problem. But when we're trying to pull out the presenting problem, we want to pay attention to what's being presented in the here and now in that moment. So now we need to know what the question is asking of the social worker. So it's asking for, us to best meet his immediate treatment needs. So in order to best meet the immediate treatment needs, the social worker should. Now we know that when we have should questions, that we need to consider the code of ethics or legal mandates. So what is the most ethical thing to do? What is the legal thing to do? And I like to tell people, what is the thing that you're going to do that will best help the client, but also make sure that you keep your license? So thinking ethically in order to best meet his immediate treatment needs. And I want to highlight immediate, because that is, it's there. So I think it's relevant for a reason. So before we go to the answer choices, we would rephrase this question as being, okay, what is the best thing that I should do, the most ethical thing that I, being the social worker, should do immediately to treat this man who appears anxious, trembling, who's having difficulty concentrating and having nightmares, okay? So now we're going to go to the answer choices and use process of elimination one by one. So to best meet his immediate treatment needs, should I assist him to develop a relapse prevention plan? Is developing a relapse prevention plan going to best meet his immediate treatment needs? Because he's trembling and anxious and all that. Is that going to resolve that issue? The answer is no. So you can confidently eliminate that one. Now let's go to B. Should I arrange for him to see a physician to address medical issues to best meet his immediate treatment needs? that's definitely something that we should consider doing. But let's read the other answer choices. Don't want to jump to any conclusions. So option C, should we complete a biopsychosocial assessment? Is completing this assessment going to best meet his immediate needs and address this presenting problem? Now, we are in, like I said, the beginning phases where we're going to do something that is around the engagement assessment processes. So is completing a biopsychosocial assessment going to best meet his immediate needs? Okay. So we don't know that right now. So I think we're going to pause on that one as well. And let's see what D is. So D says refer the client to a detox program. Is that going to best meet his immediate treatment needs? Okay, so he just got referred to you and you're going to refer him right out to a detox program. I don't think that that's the best thing to do to meet his immediate needs. That is definitely something that we can consider later on, but I don't think that's the best thing to do. So now instead of having 4 answers to choose from, we only have 2. So here we are, we're revisiting our scenario. We have a client who appears anxious, trembling, reports having difficulty concentrating, and he's having nightmares. So we want to best meet his immediate treatment needs. So what is the most immediate thing that we can do to treat him right now? And because he's having all of these physical difficulties, of course, we always rule out medical issues or attend to physical issues before we employ any mental health interventions. So this biopsychosocial assessment is a cognitive issue. So we definitely don't want to do that first. We want to arrange for him to see a physician to address his medical issues right out the gate, and then we can come, because trying to complete a biopsychosocial assessment while he's trembling and anxious and he can't even concentrate, it's kind of going to be pointless for you anyway. So answering this question, according to Maslow's hierarchy of needs, healthy and safety are basic needs, and they have to be addressed initially. So we know that, when somebody abruptly discontinues substances, it can cause serious withdrawal symptoms. These symptoms have to be treated first before attempting anything else like relapse prevention or identifying a treatment plan. So definitely let's get these medical issues, then we can, talk about a detox program, or, the physician may do that. But the first thing that the social worker should do to best meet his immediate treatment needs that will address the presenting problem, which is what is in red, is to arrange for him to see a physician to address the medical issues. A social worker is working with a family whose home was recently burglarized and the family was held at gunpoint. The 12-year-old son has begun wetting the bed and sucking his thumb, behaviors that were not present before the home invasion. The mother reports that the daughter now always wants to sleep in bed with her. The son is most likely using the defense mechanism of, okay, so of course this is another recall question about defense mechanisms. So you would definitely have to know the defense mechanisms and what takes place with each one of them. So right now we are just going to deal with the ones that are listed here. So in the scenario, we know that we have a family whose home was recently burglarized and the family was held at gunpoint. Doesn't tell us what phase of the process that we are in specifically, but I will assume we're in the beginning phases because this is something that recently happened. We have a 12-year-old son that has begun wetting the bed and sucking his thumb, and these behaviors were not present before the home invasion. And the mother reports that the daughter now always wants to sleep in bed with her. Okay, so we want to know what the question is asking. So the question is not asking anything of the social worker. It just wants to know which defense mechanism is the son, okay? The son most likely using. So we have a mother involved, we have a son involved, and we have a daughter. The question is specifically asking about the defense mechanism that the son is using. So answer choice is A, undoing. Okay, you would have to know what undoing is. Undoing is when individuals try to avoid conscious awareness of disturbing impulses by thinking or acting in a way intended to revert those impulses. So, in other words, they're trying to make something unhappen, you know. So, we're going to just put unhappen, I guess, if that makes sense. So that doesn't sound like what the son is doing. He's begun wetting the bed and sucking his thumb. So it doesn't sound like he's undoing. So we're going to scratch that one. B, reaction formation. This is when a person goes beyond denial and behaves in the opposite way to which he or she thinks or feels. So this is behaving in the opposite way of how you really feel. So is that what's going on here with our presenting problem? Is he behaving the opposite way of how he feels? I really don't think so, so I will scratch this one out. Regression. All right, so regression is when someone returns to an earlier state. So this is kind of like one of those defense mechanisms that help you cope with traumatic stressors. So you do this by acting out in a childish way, you act immature, or any type of age inappropriate manner. So you regress to earlier stages of development, such as when it was normal to, have excessive dependence on a parent or temper tantrums. So regressing is just returning to an earlier state of being. So I'm going to put that note so you can also have that. So does that seem like what the client may be doing or dealing with? Possibly, because he's went back to wetting the bed and sucking his thumb. And so these are things that you do, like when you're a child. Even the daughter, which is kind of irrelevant at this point, but she now always wants to sleep in the bed with her mom. So this is, becoming excessively dependent back on mom again. So we still have one answer choice, which is D, and that is splitting. So we have to know what splitting is. And, I just kind of take this word for exactly what it sounds like. This is really when a person has like differential views of themselves and others, and conflicting emotions. So a person who is employing splitting may idealize someone at one time, like seeing this person as all good, this great person, and then devalue them the next time, seeing the person as all bad. So this is just kind of splitting. 1 minute I'm good, 1 minute I'm bad, and that can be towards someone else or yourself. So that doesn't seem like he's having any conflicting emotions where he's splitting back and forth. So using process of elimination one at a time, we are going to go with the answer choice of regression. Again, this is recall, and you have to know those defense mechanisms because there are not specific ones that are on the ASWB exam. There will be about 2 or 3 different ones, just kind of random. So just kind of be familiar with them all. A rule of thumb, what I like to tell people is to kind of personalize it. Like, give them a name of somebody you know. If you know somebody who's always using reaction formation, use that person as, your memory trick to help remember these things. I also have a defense mechanism breakdown on the Savvy Social Worker Exam Prep YouTube channel that you can view, that it breaks them down, it compares them, tells them the difference. It's really good. So be sure to check that out if you need assistance with learning defense mechanisms. Which of the following is true of youth who are LGBTQ? Okay, so this is the recall question, so you would have to kind of know some information on LGBTQ youth. Okay, so we want to know, this is a true question, so of course we want to eliminate everything that is false about youth who are LGBTQ. So option A, they go through different developmental stages than their peers. Is this true? Actually, no, it is not. They are the same as their peers. They develop the same stages of human development applies to them. So this is definitely not True. They go through the same developmental stages. Okay. Do LGBTQ youth engage in this should be harm, self-harm or risky behavior? That is possibly true. So we're going to keep that one. Option C. They are more at risk for social isolation and poor self-image than their peers. Possibly, so we're going to keep that one as well. So option D, they are not at greater risk for mental and physical health complications compared with their peers. Well, we know that this is definitely going to go because youth who are LGBTQ, they are at a greater risk for mental and physical health complications because of, the things that they experience with their peers and of that nature. So now we're left with B and C. So which of the following is true of youth who are LGBTQ? Do you think that these youth, is it true that they may engage in self-harm or risky behavior? I absolutely think that's true. And here's C. They are not more at risk for social isolation and poor self-image than others. Actually, they are. They are more at risk for, of social isolation because youth who are LGBTQ, they face additional challenges that are, a little different from their peers, such as being taunted or, they're bullied. And that kind of results in them having more mental and physical health complications. But they also this can also cause them to have a poor self-image. And because they're experiencing harassment and rejection maybe from some of their families, the stigma of being LGBTQ does put them more at risk to be socially isolated or engage in self-harm or risky behavior because of all these negative things that they have to deal with. So they are definitely more at risk. So here the key word says not. So this is why this answer is incorrect. And the correct answer is B. This is true. Definitely no facts and information about the LGBT community because it will definitely be all over the ASWB exam. A social worker is seeing a client that identifies herself as Christian. The client tells the social worker that she is pregnant and considering having an abortion and would like to get guidance from her pastor about this decision. In response to the client's request, the social worker should first. Okay, we've read the entire scenario. Now we need to know what phase of the process we're in. Okay, so it doesn't say. So we will now go and determine what the presenting problem is. Okay, so we have a social worker. She sent a client. She identifies herself as a Christian. The client tells, we always want to pay attention to what the client says, what she reports, what she informs, what she tells. So she tells the social worker that she is pregnant and having an abortion and would like to get guidance from her pastor about this decision. So that is our presenting problem because this is what the client is telling the social worker. Again, like I said in my strategy video and my tips videos, that when we're looking for the presenting problem, that we want to pay close attention to what the client states, how the client feels, what the client informs, what they believe, because it's going to be closely related, if not be the exact presenting problem. Okay, so now we know what the presenting problem is. Now we need to know what is the question asking of the social worker to do about this presenting problem. So in response to the client's request, the social worker should first. So this is the first question. So we definitely want to do what's the most important thing. And we also want to keep the helping process in mind. But we also need to pay attention that this is also a should question, which almost all of them are going to have should do first, should do next, because the whole exam is centered around ethics. So we want to know what is the most ethical thing that we should do first about this client who's pregnant and considering to have an abortion. and would like to get guidance from her pastor about the decision. So she's sitting there with her social worker, but she's telling her social worker that she'd like to get guidance about having an abortion from her pastor because she's a Christian. So would the first thing we do be to assess the client's ability to adequately care for a child? Is that going to address the presenting problem, which is, her considering having an abortion and wants to get guidance from her pastor because she's a Christian? That is not. So that's why we're going to eliminate that one. B, would the first thing we do be to explore with the client whether speaking to her pastor is a good idea? Is that going to address this presenting problem? Possibly, so I'm going to keep that one on pause. C, should the first thing we do be to inform the client that this is a good idea as the priest should handle religious and spiritual concerns? Well, no, because that's just kind of being too generic and too broad. We're generalizing, just basically saying, yeah, just because he's a preacher, he should handle this. Or, he's a priest or pastor, whatever, that he should handle this. So, no, I definitely would not go with that as the first answer. Maybe, the more you talk about it and get more information, that would be something you do. D, determine what support is needed to prepare the client for this meeting with her pastor. Is that going to address the fact that, she's pregnant and considering having an abortion and would like to get guidance from him? And she's talking to her social worker about this. Definitely, I think that's also an option. So now, instead of having 4 questions to weed through, we only have 2. And what we're going to do is we're going to take and compare each one of these choices against this presenting problem and see what is the first one that we should do, the most ethical thing that we should do first. All right, so exploring with the client whether speaking to her pastor is a good idea. We can do this. However, she's already saying that she would like to get guidance from her pastor. So basically questioning whether or not it's a good idea probably would not be the first thing to do, or it may not be, even be the best thing to do, because, this is the client's right to self-determination. If that's something she would like to do, if she's choosing to get guidance from her pastor, it's not up to us to decide or, help her decide whether or not it's a good idea, unless she was specifically asking that. And it doesn't seem like she was asking a question. She basically said that that's what she would like to do. So we can weed that one out for that reason. D is the only one that we have left. Assessing the client's ability, of course, to care for the child is relevant. So that's why I didn't, I immediately knocked out A. So whenever we're dealing with clients, cultural competence involves working in conjunction with a lot of different supports when, or helping networks whenever we're working with these clients. So that means, we may have to work with churches or spiritual leaders or healers, depending on what, a client has going on in their culture and their lifestyle. So the social worker should definitely help prepare the client for a meeting with the pastor and provide whatever other support that she needs. So you just determine what support she needs to prepare to speak to this pastor, and you help her with that. Okay, this is an APGAR question. When collecting sensitive information in a social work interview, it is best to. Okay, so we are conducting an assessment and we are collecting sensitive information. So what is the best thing to do when we are collecting sensitive information during an assessment? Is the best thing to inform clients that answering sensitive questions is optional? This word here kind of, disturbs me because sensitive data is often needed to fully understand the problem. So making it optional is problematic, because we need to fully understand what's going on with the client. Should we be, well, let me cross that one out because that's definitely not going to be the answer. Should we reiterate limits to confidentiality, which may require the release of sensitive information? Maybe, so I'm going to put a pause on that one. C, should we offer the opportunity to provide the sensitive information anonymously? Okay, this word. Information should never be collected anonymously, only confidentially. So in interviews, as pretty much when you're interviewing the person, you know it. So it's kind of like, how will they be able to provide it anonymously when you're interviewing the person or you're doing the assessment? So this is definitely not the answer. D, should we, is it best to ask sensitive questions in the latter part of the interaction, which means save the, sensitive or maybe uncomfortable questions toward the end? That also sounds likely. So we have B and D. So is it best, when we're talking about sensitive information, to reiterate the limits to confidentiality or just save them towards the end? The best out of these two for me would be to ask the questions at the end of their interaction, because that's just pretty much a general thing whenever we're doing assessments anyway, because it allows you to develop rapport at the beginning so that the client will possibly feel more comfortable answering those sensitive questions after, some type of rapport has been established. Reiterating that information is kept confidential, it's helpful, but bringing up the limits of confidentiality, it can kind of make them kind of hesitant or reluctant to answer when you keep, reiterating, oh, this is confidential and all of that. So definitely want to, we're doing an assessment and we definitely want to focus on engaging the client, which means building that rapport and building trust with the client. A social worker at a community clinic is seeing a client who has just received a letter stating that she will no longer be receiving subsidized housing. The client is focusing solely on the stress associated with the financial challenges that this will cause for her that could result in her becoming homeless. Using a systems approach, the social worker can expect this news too. Okay, so we know we're working in a community clinic and we have a client who has just received a letter stating that she is losing her subsidized housing. The client is focusing solely on the stress associated with the financial challenges that this will cause for her that could result in her becoming homeless. So this is our presenting problem because the client, she's seeing this client and this is what the client is focusing solely on. So this tells us, yes, this is what's happening in the here and now. This is what the client is focusing on. So this is what we need to focus on. How are we going to help the client resolve this, this presenting problem? So what is the question asking of you? Using a systems approach, the social worker can expect this news too. So basically, they just want to know that we know what a systems approach is, that we know how to use this systems approach. Okay, so A, using a systems approach and knowing what's going on, can you expect this news to result in a negative impact on her financial well-being? Well, definitely we can expect that, but knowing what a systems approach is, it's pretty much this pretty much indicates that it's going to have to be something that's going to change different parts of her life, not just one area. So A is pretty much only sticking to one area, so this, which is finances. So this is not going to be the correct answer because this is not using a systems approach. Okay, so B, affect other areas of her life such as physical and mental health. Yes, this is a possible answer because it's not just one area when you're using the systems approach. System theory indicates that a change to one part of a client's life will have an impact on other aspects. So this is definitely a plausible answer. Let's go to C. We're going to pause that one and go to C. So using a systems approach, the social worker can expect this news to cause her to be worried about finding another home. Yes, it will cause her, but that is not a systems approach because, again, this is one area. This is just her worrying about her home. As A was just worried about her finances, C is only worried about her home, only affecting her in this one area. Okay, so D, building resiliency that can be used to deal with other life crises. I think this is kind of irrelevant, especially to the systems theory or using a systems approach, yes, of course, it can build resiliency that can be used. But the social worker expecting this news to just, by her getting this news, automatically, thinking, oh, this is going to help her build resiliency that she can deal with other life crises, that's kind of irrelevant at this point. So B is the best answer. This situation requires the social worker to view the client's housing crisis using the systems approach. Okay, so although the subsidy loss is causing her financial concerns, it would also have an impact on other aspects of the client's life, such as her physical and mental health, because, she's already kind of, getting work, she's worrying about it. So this can cause her, to have anxiety symptoms and all of that. So it's not just impacting her financially or just impacting her, causing her to worry about finding another home. It's both going to take a toll on her physical and mental health, because we know what stress does. So that's why B is the answer, because we are using a systems approach. I just want to point out that you see how most of these answers were correct, but they weren't correct for what the question was asking. So we definitely want to pay attention to what the question is asking. As in the 1974 Tarasoff ruling, the statute notes that the principle of duty to warn social workers must. Okay, so here we are dealing with the principle of duty to warn, and this is a must question. It's not highlighted above it, but do pay attention to it. So in dealing with the principle of duty to warn, what must the social workers do? Should we A, notify both the authorities and intended victims of imminent danger? Yes, we know that that is one of the principles of duty to warn. So we'll pause that and see what else is going on down here. So option B, should we seek inpatient hospitalization if dangerousness exists? No, that is not one of the principles of duty to warn. Should we notify only the intended victims of imminent danger? Definitely, we know that is not a principle of duty to warn. We have to notify the authorities as well. So that's being taken out. And should we identify the risk factors that are linked to the dangerousness to others? Identify risk factors that are linked to dangerousness to others. Definitely, no, this is not a principle of duty to warn. The primary principle of duty to warn is to notify both the authorities and the intended victims of imminent danger. Duty to warn pretty much means that social workers must verbally tell intended victims that there is a foreseeable danger of violence. So in addition, social workers, we also have a duty to protect. So, if we determine that our clients, present a serious danger of violence to others, we have an obligation to use reasonable care to protect the intended victims against danger. This may entail, us notifying the police or taking other necessary steps. So that's why, it's not just only the victims, we have to notify the authorities as well. All of the following are associated with borderline personality disorder, except. So we know that, this is going to be one of those DSM type questions that you have to know, certain aspects, signs or symptoms of different disorders. I know that borderline personality is one of the common ones that shows up on the ASWB exam. This is actually an APGAR question. So basically, you just kind of need to know the signs and symptoms of borderline personality disorder. I would recommend that you study this one because, like I said, this is one of the common disorders that show up on the exam. So which one is not associated with borderline personality disorder? Poor impulse control. Well, we know that that's definitely associated with borderline personality disorder. Control of aggressive drives. Well, this is the opposite of A. Usually when you have two answers that are totally opposite from each other, one of them is the answer. And so in this case, I am going to say that the answer is B, but however, I don't want to jump to conclusions without reading the other answer choices. So of course, dichotomous thinking, Yes, that is definitely associated with BPD. So we're looking for the exception. So emotional dysregulation, that is definitely a big symptom of BPD. So the only one that is not associated with BPD is a person being in control of their aggressive drives, which again, that's opposite of poor impulse control. Clients with borderline personality disorder tend to view the world in black and white, all or nothing, dichotomous thinking. These polarized thoughts lead to intense emotional reactions that are unable to be regulated, okay? Clients with borderline personality disorder often engage in self-destructive behavior and act impulsively. So having control of their aggressive drives is definitely not the answer here. A social worker is reviewing intake paperwork received for a new 57-year-old client. It states that he is currently taking risperidone after being switched from clozapine. The client is most likely diagnosed with which of the following? Okay, so now we know we're dealing with an older client here, and he's currently taking risperidone after being switched from clozapine. So the question is asking us, what is the most likely the client most likely diagnosed with? So if a client is taking risperidone and clozapine, we need to know, what class of medications this is for. So this is one of those medication questions that also requires you to know, different diagnoses. So insomnia disorder, will these two medications treat insomnia disorder? So first of all, what type of medications is this? If we have a client that is taking risperidone after being switched from clozapine, this to me, knowing the medications, you have to know that they are both antipsychotics, so that your answer is going to be some type of psychotic disorder, okay? Insomnia is not the answer because this is not a psychotic disorder, okay? Schizoaffective disorder, that is a psychotic disorder, but let's see what the other options are as well. So option C, major depressive disorder, is not a psychotic disorder, so definitely wouldn't be taking risperidone or clozapine for major depressive order primarily. Antisocial personality disorder, this is not a psychotic disorder either. So the only psychotic or disorder on this list is schizoaffective disorder, so that lets me know that this is my answer. Risperidone and clozapine are both antipsychotics for the treatment of schizoaffective disorder. Although the client may have other diagnoses, he is most likely diagnosed with schizoaffective disorder, which would require the use of an antipsychotic. So he may have some, depression or whatever, but he's not being prescribed these medications for that. So we definitely want to go with the psychotic diagnosis. A social worker is evaluating a client who says that she has been having suicidal thoughts, but assures the social worker that she does not plan to hurt herself. In order to best assist the client, the social worker should first. Okay, so this is a first question, we know, but let's see what's going on in here. So it says that the social worker is evaluating the client, so we know that we're somewhere in the beginning processes, the beginning phase. So the client says that she has been having suicidal thoughts, but assures the social worker that she does not plan to hurt herself. So this is our presenting problem. This client, says this during an evaluation. So the question wants us to do what? What is the question asking of the social worker? So in order to best assist the client, the social worker should first. This one got all those good words up in here for y'all. It has the word best as well as the word should. So in this situation, we want to know what's the best thing, the ethical thing that we should do first for the client. So in order to best assist the client, we have to always meet the client where they are. So keep that in mind. So now we are going to go to the answer choices. So should the first thing we do be to conduct a risk assessment? Would that be the best thing to do to assist the client who says she has been having suicidal thoughts, but assures the social worker that she does not plan to hurt herself? Notice I'm referring the choice back to the presenting problem, okay? So we are in the evaluation stage. So we know what happens In this phase of the process, we're usually engaging the client and assessing the client, okay? So conducting a risk assessment is highly likely. Let's see what the other answer choices are. B, acknowledge and explore the client's feelings and concern. Is that going to best assist the client? Okay, is that the ethical thing? Is that the first thing that the code of ethics would require us to do for a client who's saying that she's been having suicidal thoughts, even though she assures you that she does not have a plan, okay, to hurt herself? Is acknowledging and exploring the client's feelings and concern the best way to assist her? Okay, maybe. So we'll keep that answer on pause as well. Is the best thing to do is to refer the client to a psychiatrist for a medication evaluation? Absolutely not going to be the first thing we do. We are in evaluation, so we have to continue to assess her and evaluate what's going on with her. So definitely not going to first refer her just because she says she's been having suicidal thoughts. Oh, you need to go see a psychiatrist. You might need some medicine. No, that is not the first thing we're going to do. So that's going to be eliminated. Okay. D, do we first suggest that the client go to an inpatient hospital? First of all, this is just a suggestion. So how is that going to help her if the client is, how's that going to best assist her, should I say? What if she decides that she doesn't want to go? If she's assuring you that she doesn't plan to hurt herself, then she's probably not going to, take you up on this suggestion. So definitely this is not the answer. Okay, so now we have A and B. So we're trying to figure out, what is the best thing to do first about a client who is telling you that she has suicidal thoughts, but she doesn't have a plan to hurt herself. Okay, and knowing this, of course, we always want to, I know, using acronyms and all this other stuff, it'll tell you, oh, you first want to acknowledge the client's feelings and all this stuff. So this is why I don't teach acronyms, because they become tricky in a lot of situations, especially those such as this. So despite the client's report that she will not act on her thoughts, she is still at risk because she's having these feelings. So a safety assessment will determine the severity of those thoughts and feelings and whether she is at risk for a suicide attempt. So it must be done first before any other actions are taken, okay? So you are definitely going to, this is not just a CYA, this is the best way to assist the client, because she may be thinking, oh yeah, I don't have any plans at this moment to hurt herself, but maybe they may arise later on. So we need to assess for all that. We need to assess the severity of these thoughts. A social worker is meeting with a client who is referred by her employer due to issues with her coworkers. After completing an assessment, the client states that she would like to work on being more assertive with her colleagues. In order to best assist the client, the social worker should first. Okay, so let's see, we've read the scenario, kind of got a glimpse of what's going on. She's meeting with a client who was referred by her employer. So we know that this is kind of in the beginning phases. So we're somewhere around the engagement and assessment phase. And so she was referred due to issues with her coworkers. That's important to point out. Okay. The client states that she would like to be more assertive with her colleagues. This is the presenting problem. We know that she was referred due to issues with her coworkers. So that's tied to the presenting problem. However, the primary presenting problem that comes from the client, because of course we're dealing with the client, so we don't just want to deal with, why she was referred or why the employer, referred her. We want to deal with what she feels her issue is. So by her stating that she would like to work on being more assertive with her colleagues, this is our presenting problem. So now we know what our presenting problem is. We need to, and we know what phase of treatment we're in. We're at the beginning, in one of those beginning phases. So now we need to determine what the question is asking us to do. So it's saying, in order to best assist the client, the social worker should first. So what is the first thing that the social worker should do about a client who wants to work on being more assertive with her colleagues, okay? Would the first thing you do be to provide the client with communication strategies aimed at self-expression? Is that the first thing you're going to do, at the beginning stages while you're, in the engagement or assessment phase? No, you're definitely, this is more like, an intervention. So we're not even there yet because we're still in the beginning phases. So this is not the answer. Would the social worker first assist the client with identifying classes aimed at assertiveness training? This also is an intervention that I think will come later. So it's definitely not the first thing you're going to do during an assessment, Okay. So C, will the social worker gather information on issues at her current and past jobs that have resulted from communication barriers? This seems like it's doing too much. However, if you're gathering the information from her, then maybe we can get a clear picture. So I'm going to just hold on that and see what D says. Okay, so D, should the first thing we do about this client who wants to work on being more assertive be to identify the outcome that she hopes to attain from this behavior change? That sounds more plausible to me than just gathering information, because we are trying to help this client with her presenting problem. And if her plan is if her problem is that she wants to work on being more assertive with her colleagues, just gathering information on the issues is not going to resolve that. So it becomes very clear to me when I am focused on the presenting problem, what I should do, because the question is asking me, how can I best assist the client? So gathering information is not going to really assist her with what it is she wants to achieve. So we are in the beginning stages of the process. So we definitely want to, kind of ask her about what outcome she hopes to obtain. So we are kind of like, in the planning stage of the problem solving process, really, because she's already kind of identified what her needs are, what some things she wants to work on. So the first two responses, basically, like I said, they're interventions. However, in order to determine their appropriateness, the social worker must clarify with the client the desired outcomes and what she means by, wanting to be more assertive. So clearly defining the problem and how it relates to positive and negative aspects of the client's life will assist in the formation of an appropriate intervention, treatment, or a service plan. So we definitely need to identify, what are the outcomes that she wants to see. So, and that's pretty much clearly defining the problem in this planning stage of the problem solving process, because she's already identified to you what it is she wants to work on. So that means let's, start creating this plan. Since we've already identified her needs, now let's create this plan to meet her needs. But to do that, we definitely want to identify the outcome that she's seeking. A social worker meets with a client who is chronically mentally ill. The client often refuses to take psychotropic medication, but does not yet exhibit symptoms of active psychosis. What approach is most likely to help the client achieve long-term optimal functioning? Okay, so what's going on in this question is we have a client who is chronically mentally ill, and the client often refuses to take the psychotropic medication, but does not yet exhibit symptoms of active psychosis. So the question is asking the social worker which approach is most likely to help the client achieve long-term optimal functioning. Okay, so the presenting problem here is that the client often refuses to take, his or her medication. So that's what our issue is here. Okay, even though he's not yet exhibiting symptoms of active psychosis, we definitely want to keep it that way. So refusing to take the medication is definitely the presenting problem. So what can we do? What approach can we take to most likely achieve long-term optimal functioning? So this is what we're trying to do about this presenting problem, okay? So A, developing a behavioral program to enhance medication compliance. Is that something that we could do that will help to achieve long-term optional functioning in regards to this presenting problem, which is the client refusing to take psychotropic medication? Yes, that is something that we could possibly do. So, but we want to see which one will most likely help the client. So let's see what are the options we have. Referring the client to a day treatment center. Is that going to help the client who's refusing to take the medications achieve long-term optimal function? Functioning just by referring him to referring him to a day treatment center. Excuse me. Definitely not. Doesn't even make sense. So we're going to eliminate that one. Referring the client for long-term hospitalization. Is that going to help him achieve long-term optimal functioning by hospitalizing him? Definitely not. So we're going to take both of those referrals out. D, arranging for medication, excuse me, to be administered by a visiting nurse. Okay, so we have options A and D. And if we go back and compare each one of these to what the problem is, we need to determine which one makes the most sense and which one is going to do what the question is asking us to do, which is, choose the approach that's most likely to help the client achieve long-term optimal functioning. So, developing a behavior program to enhance medication compliance. I think that this one does address the fact that, the client is refusing to take the medication. So if we develop a behavioral program to enhance his compliance, then that will help him to achieve long-term optional functioning to basically keep him from exhibiting these symptoms of active psychosis, okay? Arranging medication to be administered by a visiting nurse. He could still refuse that. Just like, he's refusing it now. When the nurse comes to visit, he can refuse that as well. So I would, definitely eliminate that one and go with answer choice A. The only approach most likely to help, with that is the one that kind of caters to medication compliance, because the presenting problem is a refusal to take medication. So developing a behavior program to assist with this, rather than having the medication administered by a nurse that he can still refuse it to, it better honors the client's self-determination, and it's less restrictive, because it's not like you're sending a nurse over there kind of like to force him to take the medication. Referring him to a day treatment center or for long-term hospitalization are most likely not going to help the client to achieve long-term optimal functioning, which is what the question was asking us to address. So the answer here is definitely A, because it directly addresses what the problem is. We have a client that's refusing to take medicine. So the answer here is to come up with a program that will enhance the client's medication compliance, which will in turn help the client to achieve long-term optimal functioning. We are not, limiting his rights to self-determination or forcing him to do something. We are just, enhancing his will to want to comply with his medication regimen.